I'm about to show you 7 warning signs your feet are giving you right now that mean diabetes is already damaging your body. Your doctor may have told you your blood sugar is just a little high, just borderline, nothing to worry about yet. But the damage in your feet does not wait for the diagnosis. It is already happening at levels your doctor calls normal. Most people find out about diabetes from a blood test, but your feet knew first, months before the blood work moved, sometimes years before. I'm going to show you all 7 signs. I'm going to explain exactly what is happening inside your feet that causes each one. And I'm going to give you the exact steps to take if you find any of them tonight. But sign number 4 is the one you need to pay attention to. It is the one most people have right now and completely ignore. It is the one that tells you whether you are going to keep your feet or lose them. And I have never seen it explained properly anywhere. I'm also going to show you 3 things that are speeding up the damage right now. 1 is something your doctor gave you. 1 is something you wear every day. And 1 is something you do every evening that feels harmless but is destroying your feet while you think you are taking care of them. By the end of this video, you will know exactly what to look for on your own feet tonight. You will know which signs mean you caught it early enough. You will know which signs mean the window is closing. And you will understand why a woman named Gloria spent 4 years watching her feet go silent while 3 different doctors told her she was fine. I have held the hands of patients whose feet could have been saved. The tissue was still alive. The blood was still partially flowing. The nerves were hurt but not gone. If someone had looked at their feet 6 months earlier and known what they were seeing, those patients would still be walking, but nobody looked. Nobody taught them. Nobody. And by the time they reached me, the only choice left was to take the foot. Stay with me. This starts with Gloria. Gloria was 71 years old, a retired piano teacher from Savannah. She spent 48 years teaching children to play. Her feet worked the pedals for thousands of hours, sustain, soft, the tiny differences in pressure that turn notes into music. Gloria's feet were part of the instrument. 4 years ago, her doctor told her she was pre-diabetic. Her A1C was 5.8. He said, "Watch your diet, exercise more, we will check again in 6 months." Gloria did everything he said. She walked every morning. She changed what she ate. She came back every 6 months. And every 6 months, her A1C was between 5.7 and 6.0, never crossing the line, never triggering a diagnosis. Her doctor said the same thing every visit. "You are doing great. Keep it up. We are watching it." For 4 years, everybody watched. Nobody acted. And during those 4 years, Gloria's feet were changing. She noticed the first thing at year 1, but I am not going to tell you what she noticed yet, because you need to understand what was happening inside her body first. If I just list the signs, you will look at your feet, see one, and think, interesting. You will not feel why sign number 4 is different from all the others. Let me show you what happens inside the smallest blood vessels in your feet when your blood sugar stays even slightly above normal. Because this one thing is the engine behind every sign I am about to show you. Your feet are the farthest point from your heart. The blood that reaches your toes has traveled longer than blood going anywhere else. The tiny vessels that feed your toes are so small that blood cells pass through one at a time, single file. When blood sugar stays high, even at levels your doctor calls borderline, sugar molecules start sticking to the walls of those tiny vessels. They attach to the proteins that line the inside. Those proteins get stiff. They stop working the way they should. This triggers a chain reaction. The vessel walls get inflamed. They swell up. The opening gets narrower. Less blood gets through. Less oxygen reaches the tissue. Less food reaches the nerves. And here is the part your doctor probably never said out loud. This damage does not wait for a diabetes diagnosis. It does not start at 6.5. It starts at 5.7. The moment your blood sugar enters the pre-diabetic range, the smallest vessels in your feet are already being destroyed. Gloria's A1C was 5.8 For 4 years, she was told she did not have diabetes, and she did not. But her blood vessels did not know that. They were being damaged the entire time. This is the engine. Sugar sticking to vessel walls, vessels swelling shut, blood flow dropping, nerves starving. Everything you see on the surface of your feet traces back to this one process running silently in vessels too small for any scan to find. Now, the 7 signs. I am holding sign number 4 until you are ready for it, because that one is not just a sign, it is a clock. And where the clock is tells you how much time you have left. Sign number 1, cold feet. Take your shoes off right now. Touch the top of your right foot with the back of your hand. Now your left foot. Are they the same temperature, or is one cooler than the other? If one foot is always cooler, that means the tiny vessels on that side are more damaged. Less blood flow means less warmth. But here is what matters more. Are both feet cold? Even when the room is warm? Even under a blanket? Even in summer? Both feet cold in someone over 60 with blood sugar above 5.7 is not aging. It is the earliest sign that the blood supply to your feet is failing. Gloria noticed cold feet in year 1. She bought thicker socks, mentioned it to her doctor once. He said circulation slows down with age. He was not wrong, but he was not asking the right question. If your feet are cold right now, write cold feet in the comments. I want to see how many of you have this and were never told what it means. Sign number 2, color changes. Look at your feet right now. Look around your toes, your ankles, the top of your foot. Do you see any patches that are darker than the skin around them? Not bruises, a reddish brown or purplish color that showed up slowly and never left. Here is what causes that. When those tiny blood vessels get damaged by sugar, they start to leak. Blood cells seep out through the walls into the surrounding tissue. The iron in those blood cells breaks down and stains the skin like rust. That brownish patch on your ankle is literally rust forming under your skin from blood vessels that sugar has been destroying. Gloria saw brown patches around her ankles at year 2. She went to a skin doctor. He gave her compression stockings. He was treating the surface. The engine underneath was sugar destroying her vessels. The stockings did nothing to stop it. Sign number 3, cuts that will not heal. Think about the last time you nicked your foot. A scratch, a blister from a shoe, a small cut. How long did it take to close? In a healthy person, a small wound on the foot closes in 3 to 5 days. The blood brings everything the tissue needs to repair itself. When the blood supply is damaged, the repair crew arrives late, or does not arrive at all. A cut that should close in 5 days stays open for 2 weeks, 3 weeks, or it refuses to close at all. Gloria cut her toe on a kitchen cabinet at year 3. Tiny nick, barely bled. She put a bandage on it and forgot about it. 2 weeks later, still open. 3 weeks, the skin around it started turning gray. Not red, not infected. Gray. Gray is the most dangerous color in medicine. It means the tissue is deciding whether to survive or give up. And the decision depends on whether blood flow improves in the next few days. But I am not going to tell you what happened to that wound yet, because sign number 4 is next. And everything I have shown you so far, the cold feet, the color, the wound that would not close, those are the warning lights on the dashboard. Sign number 4 is the engine light, the one that tells you how much time you have before something breaks that cannot be fixed. I have been building toward it since the beginning. Here it is. Sign number 4, you are losing feeling in your feet, and it is happening in a very specific pattern. Take off your socks, grab a pen, turn it around so the blunt end faces down, the cap end. Press it firmly into the bottom of your big toe, not lightly, press it. Can you feel it clearly? Not just the pressure, can you feel the shape? Can you tell it is a pen cap and not a fingertip. Now move to the second toe, same thing. Third, fourth, fifth. Now the ball of your foot just below the big toe. Now the arch, now the heel. Here is what you are finding out. The nerves in your feet are the longest nerves in your body. They run all the way from your spine to the tips of your toes. They are the first nerves to starve when blood flow drops. And when they start to go, feeling does not disappear all at once. It disappears in a very specific pattern. It starts at the tips of the toes and moves backward like a tide going out. If you can feel the pen on your heel and your arch but not on your toes, the tide just started going out. The window is still open. The damage may still be reversible. If you cannot feel the pen on your toes or the ball of your foot, the tide has reached the middle. The window is narrowing. This is urgent. If you cannot feel the pen anywhere on the bottom of your foot, the nerves are badly damaged and you are in danger, not just from the numbness, but from what comes next. Because when you lose feeling in your feet, you lose the ability to feel injury. You step on something sharp and do not know. You get a blister and do not feel it. You burn your foot and do not notice. The wound opens, and because the blood flow is already damaged, the wound does not close. It sits there, open. You cannot feel it. The body cannot heal it. Bacteria move in. This is how people lose their feet. Not from something dramatic, but from a tiny wound they never felt on a foot that could never heal it. And this is exactly what was happening to Gloria. Remember, I told you she noticed something at year 1. I told you I would come back to it. Gloria lost feeling in her toes at year 2. She knew the exact moment. She was teaching a student. She pressed the sustain pedal, and the feedback was gone. Half pedal, quarter pedal. The tiny differences in pressure that she had felt for 48 years were gone. Her feet had gone silent. The instrument that shaped a lifetime of music could no longer feel the pedals. She told her students she was retiring because of arthritis. She did not tell them the truth. The woman who taught 1,000 children to play could no longer feel the keys beneath her feet. Now, I told you sign 4 is a clock. Let me explain why. There is a test your doctor can do in 30 seconds that tells you exactly where the clock is. It uses a thin plastic thread that bends at exactly the right pressure. Your doctor presses it against the bottom of your foot. If you cannot feel it, you have lost what doctors call protective sensation. You are at serious risk. This test costs nothing, takes half a minute, and most seniors with blood sugar above 5.7 have never had it done. Because the guidelines say start testing at diagnosis, not before. Gloria was never tested because she was never diagnosed, because 5.8 was not 6.5. At your next appointment, say these exact words. I want a monofilament test on both feet. I am concerned about nerve damage. Those specific words. The system responds to that language. You now have it. Before I give you the last 3 signs, let me tell you why I am giving you so much in this video and why it still is not enough. Everything I am showing you right now, the signs, the mechanism, the test to ask for, this is valuable. But knowing the signs does not reverse the damage. Knowing the mechanism does not restore the blood flow. Knowing which test to ask for does not tell you what to do when the results come back. There is a gap between understanding what is happening and actually fixing it. And most people fall into that gap. They learn more, they feel better about learning more, and they go to bed that night with the same feet they woke up with. What closes that gap is not more information. It is a system. One morning routine, one evening routine, one set of steps done in the right order that gives your body what it needs to start rebuilding the blood supply to your feet. Not complicated, not expensive, not overwhelming. The kind of thing where you start on a Monday and by the following Monday, you notice your feet feel warmer in the morning. Not fixed, not healed, but warmer. That first small sign that blood is reaching places it had stopped reaching. That is the kind of fast win that makes you keep going because the body does not lie. When the blood starts flowing again, you feel it. And that feeling is what carries you through the next 7 weeks until your doctor looks at your feet and says something your chart has never contained. I will tell you exactly how to get that system before this video ends. But first, the last 3 signs, because 2 of them are things you have probably noticed on your own body and dismissed as normal aging. They are not. And the third one is the cruelest trick your body plays on you. It sounds like the opposite of numbness, but it happens at the same time. Sign number 5, your skin has changed. Run your hand along the top of your foot and up your shin. Does it feel different than it used to? Thinner, smoother, almost shiny. When blood flow drops, the skin cannot maintain itself. The hair on your toes and lower legs stops growing. The skin thins out, gets fragile, almost see-through in some areas. If you have lost the hair on your toes and your skin looks shiny and tight, that is not aging. That is your skin telling you the blood supply has been cut. Sign number 6, your toenails are fighting you. Thick, yellow, brittle, crumbling. Fungal infections that come back over and over no matter what cream you use. The nail needs blood flow to grow healthy. When that blood flow is cut by damaged vessels, the nail grows slowly and badly. Fungus moves in because the immune cells that should fight it cannot get there fast enough. Toenail fungus that will not go away in someone with blood sugar above 5.7 is not a foot problem. It is a blood flow problem wearing a disguise. Sign number 7, burning pain at night. Not the ache of a long day, not sore muscles, a burning, a tingling, pins and needles that come and go, sharp stabbing pains that shoot through your foot for no reason. Worse at night, worse when your feet are still. This sounds like the opposite of numbness, and it is, but it happens at the same time. The nerves are shutting down, but as they shut down, they misfire. They send pain signals to your brain that have nothing to do with any real injury. Your brain receives pain from a foot that is being destroyed from the inside, and the pills your doctor gives you for the pain do not stop the destruction. They just turn down the alarm. Gloria had this every night, burning that made sleep impossible. Her doctor gave her gabapentin. It helped her sleep, but it did nothing to stop the nerve destruction causing the pain. He was treating the alarm. Nobody was putting out the fire. And the fire was the same engine I showed you at the beginning. Sugar, vessels, blood flow, nerves, all connected. All fixable, but only if someone stops treating the alarm and starts addressing what is actually burning. That is coming. But first, the 3 things making all of this worse right now. Saboteur number 1, something your doctor gave you. If you take a statin for cholesterol and your legs have gotten weaker since you started it, your statin may be making this worse. Statins can cause muscle weakness in the legs. Weaker legs mean less walking. Less walking means less blood flow to your feet. Less blood flow means the nerves starve faster. I am not saying stop your statin. I am saying if your legs have gotten weaker and your feet have gotten worse at the same time, that conversation needs to happen at your next visit. Saboteur number 2, something you wear every day. Your shoes. Tight shoes that squeeze your toes. Shoes that press on the tiny vessels in your feet that are already damaged. Tight shoes on feet with bad blood flow are like putting a clamp on a garden hose that is already barely running. Every hour you wear them, you are choking off what little blood your feet have left. Gloria wore her Sunday shoes to church. 2 hours of squeezed toes on feet that were already starving. She got a pressure sore on her little toe. She could not feel it because the numbness had already taken that toe. The sore turned into an open wound. It took 4 months to close. Get shoes with a wide toe box. Your feet need room. This is not about comfort. It is about keeping your feet alive. Saboteur number 3, something you do every evening. Soaking your feet in hot water. Epsom salt baths. Putting a heating pad on your feet for the burning pain. If you have lost feeling in your feet, you cannot tell how hot the water is. What feels fine to your hand can burn skin that cannot feel it. The burn opens a wound. The wound does not heal. Gloria burned the bottom of her foot on a heating pad. She used it every night for the burning pain. She did not feel the burn happen. The blister opened. It stayed open for 6 weeks. If you have any numbness in your feet, never use hot water or heating pads on them. Test temperature with your hand first, always. Now, you have the 7 signs. You have the 3 saboteurs. Everything I have shown you so far has been the problem. Now, I am going to show you what to do about it, and it is simpler than you think. Step 1. Get the right test. Do not just ask for a blood sugar test. Ask for fasting insulin. Here is why. Your body can keep blood sugar looking normal for years by pumping out more and more insulin. The sugar looks fine, but insulin is through the roof, and that high insulin is driving the inflammation and vessel damage in your feet. Gloria's blood sugar was borderline for 4 years. Her insulin was never tested. If it had been, the whole picture would have had a name and a treatment years earlier. Ask for fasting insulin and ask for the monofilament test. Both feed at the same appointment. Step 2, walk until it hurts. This sounds cruel, but when your leg muscles work hard enough that they run out of oxygen, they send out a chemical signal that tells your body to grow new blood vessels. New tiny vessels branch off the existing ones. They create detours around the damaged areas. The only way to grow new blood supply to your feet is to demand it through exercise that pushes you to the point of discomfort. This is not a gentle stroll. Walk until your calves ache, until your feet complain. Then rest, then walk again. The ache is the signal. It means your body is building new roads to your feet. Step 3, check your feet every single night. Every toe, between every toe, the sole, the heel. Look for anything that was not there yesterday. A cut, a blister, a red spot, a color change. If you cannot see the bottom of your feet, use a mirror on the floor. If your eyes are not good enough, ask someone to look for you. One wound you do not notice, one blister you cannot feel. That is where the path to losing a foot begins. Step 4. Protect them like they are the only pair you will ever get, because they are. Now let me tell you what happened to Gloria. Her daughter is a doctor, and her daughter did something at Thanksgiving dinner that changed everything. She looked at her mother's feet. Not because Gloria asked, but because she noticed Gloria had stopped wearing sandals. Her daughter saw the brown patches. She saw the thin, shiny skin. She touched the toes. They were cold. She pressed on the toenail. Gloria did not flinch. She asked her mother one question. "Mom, can you feel this?" Gloria said, "Feel what?" Her daughter ran the pen test that same night at the kitchen table. Gloria could not feel anything below her ankles. 2 days later, Gloria had blood work. Fasting insulin was 22, almost 3 times what it should be. Her A1C was still 5.9, still not diabetic by the chart, but her feet were already years into the damage. Her daughter started her on a protocol. The specifics are more than I can fit in this video, but the foundation was what I told you today. The walking program to build new vessels, the foot checks every night, the right shoes, the insulin addressed directly. Week 1, Gloria said her feet felt slightly warmer in the mornings. Not dramatic, just warmer. Week 3, the burning at night started to ease, not gone, but quieter. Month 2, she did the pen test again. She could feel it on the ball of her foot, not her toes yet, but the ball. The tide had stopped going out. Month 4, Gloria sat down at the piano for the first time in 2 years. She pressed the sustain pedal. She felt the resistance. Not perfectly, not like before, but she felt it. She played one song. Her daughter recorded it. Gloria cried through the entire thing. Not because of the music, but because she could feel the pedal under her foot. She told her daughter afterward, "I thought that part of me was gone forever. It was not gone. It was starving. And when the blood came back, so did she." Now, I told you at the beginning that knowing the signs is not enough. I told you there is a gap between understanding what is happening and actually reversing it. Gloria's daughter is a doctor. She built the protocol herself. Most people do not have a doctor in their family who will sit at the kitchen table on Thanksgiving and test their feet with a pen. That is why I built the blood pressure protocol. I know the name says blood pressure, but in seniors, blood pressure and blood sugar are not separate problems. They run on the same engine. The same insulin resistance that destroys the tiny vessels in your feet is the same thing that stiffens your arteries and drives your blood pressure higher.